Good afternoon. First, thank you very much for Eva for having done a lot of publicity of our initiatives. It is nice to see that the Parliament is looking with good eyes to what we are doing in DG Connect and in the Commission in general, so thank you very much. And thanks for the organizers as well to invite me and to talk about this very important issue. Let me first tell you where I come from, because the Commission is very large. There are many DGs, General Directorates. So, as it was announced, I'm coming from the DG Connect, which is the digital DG. We are working on the uptake of all these new technologies to ensure that this is going to contribute to the digital single market and to all these opportunities that Eva mentioned. But I am not working in DG Justice, who's the owner of the General Data Protection Regulation, neither in DG Grow, who are the owners of the Medical Devices Regulation. So I prefer to say that at the beginning so you know exactly in which field we are working. Even, of course, we are following what they do because it's very much related to our activities. So I work in the e-health unit, e-health, well-being and aging. We used to be two units before, one dealing with the e-health and the other with the aging. Now we merged since July because it doesn't make sense. We are aging since we are born. So e-health, m-health need to tackle all human beings. Okay, so European systems for health and social care have been very successful in the past. They significantly contributed to our improved health, well-being and increased longevity. But these systems need to evolve today if we want them to effectively address the challenges of the future. Budgetary constraints, demographic change, and increasing citizens' expectations are the variable of an equation which will be very difficult to solve. I like very much this slide because it shows really how the demographic imbalance is very quickly going on. So population projections suggest that people will get older, while birth rates will remain low. And this will put economic growth at risk and will add to fiscal pressures through a greater reliance on old age pensions and health services. Demographic aging, demographic change is indeed a major challenge for all of us. More people will be dependent on others to take care of them, while there will be less people active in the economy to procure those services and pay for them. Just as an example, it is expected that already in 2025, the shortage of carers will be of 20 million, which is huge. So as Eva said, as a consequence of this, the cost of chronic diseases will increase significantly. And nowadays, we have to be aware that 10% of the population represents 65% of the healthcare costs. So, taking into account that at 65, the average is to have at least 2 chronic conditions, we can imagine how this risk of getting worse in the future. And also, I mentioned there is increasing citizens' expectations. What does it mean? It means that now, as the societies in Europe particularly are getting more prosperous, we expect more things to come. So, for example, being healthy, it's not only not to have a disease, but it's also to have a good quality of life. Things that before were considered normal when you get old, now are considered and perceived as treatment, as problems that need to be treated. So this all to say that Europe needs to adapt to ensure the future sustainability of our health and care systems that need to become more cost-efficient, more person-centered, and enabling quality living with chronic conditions. In this context, digital technologies can certainly be part of the solution. They cannot solve it all, but they can be part of the solution. They have a lot to offer to enable a new model that would meet our needs and represent a big potential both for citizens, for healthcare providers, and for the industry. But they cannot come alone. They need to come with new mindsets, new organizational approaches, new skills. In summary, there is a need for a fundamental transformation of the way we think about health and care. And this needs a shift in focus, leading to, 1, increased community and home-based care, so less hospitals. It's not that we will not need the hospitals, of course they will be needed, but the less we use them, I mean, the more we stay at home, the cheaper for the system, and also for the quality of life of the person with diseases. So this is one of the objectives. A second objective would be early prevention. We want people to stay longer healthy because that's also the cheapest, but also the best for them. And the third is we want them to participate. Citizens are strongly, requested now to participate in their health and care process. And as I said, it's to ensure that they are active, independent, and healthy as long as possible. So you will have understood that for the three things, for the prevention, for the empowerment of the citizens, and for the more home-based care, the only possible solution is mobile health. Not alone, but mobile health is clearly the answer. So the e-health action plan that was referred before already mentioned the potential benefits of e-health, of m-health, for the citizens to be more empowered, receive more prevention and earlier and better treatment. Also for the healthcare systems, because they would allow for more efficient use of the resources. And also a huge market potential. So we always talk about the triple win, but I like to add a fourth win, which is the research win. Because you can imagine that the huge amount of data that is generated by all these technologies, wearables, sensors, apps, and whatever will come with it as the technology advances very quickly, if it was used, it could represent really, enormous opportunities for the research to advance in the understanding of the health patterns, to be used to cure diseases, but also to prevent them and preserve them. So a public consultation was launched, as it was mentioned as well, and on many concerns were raised, like little clear evidence on the quality and reliability of the large number of lifestyles and well-being apps, the need to educate and inform the end users, the importance of sharing and transferring the best practices. We are all together. It doesn't make sense to reinvent the wheel all the time. So let's focus on the transfer of knowledge. The need to clarify the legal framework, and also the achievement of a right balance between innovation and regulation, because in many cases it is preferred to have guidelines, quality labeling, than only very strengthened regulations, which also takes so much time to be agreed that at the end the technology goes much faster. In this context, DG Connect has launched several initiatives. I'm not going to go in detail. If you have questions, you can ask afterwards. But to tackle the privacy and the trust, we have been working on a code of conduct for apps. To tackle the quality, there are two main actions. One is currently under the SEN, and it's to push for a European standard on quality criteria for health and wellness app developers. Another is a working group on define the guidelines on criteria for assessing the validity and reliability of m-health apps, with the main objective of exporting the data to the electronic health records so that it can be exploited by for example, by the doctors. Also as concerns safety, there has been an action there, a public consultation recently closed. And then Horizon is providing funding to tackle some of the concerns. For example, we have had in 2016 a topic on digital health literacy. We regularly have topics to increase the interoperability. And also we are very, very soon going to sign an agreement with the WHO and the E2 to create a hub on m-health, with the main objective of helping 4 member states to implement their national strategies on m-health, and also to collect data and evidence of the best practices. Okay, so yes, I mentioned all that. I should have passed to these slides earlier, but basically these are our main actions. The invitation to the conference highlighted the importance to address some critical factors, such as privacy and security and interoperability and standards, and I could not agree more. Trust and security are essential for scaling up the use of digital innovations in health, and m-health solutions should ensure privacy and security by design, and not only the apps and the devices, but all the system, because we are more and more confronted with cybersecurity issues. So the objective is that the whole system is protected enough as to make sure that your data will not be corrupted or violated. And I think a lot will have to be done in the future in this side, because this is really, every day we can find something in the articles about this problem. Interoperability. We all agree that electronic health records can provide vital information within a second, as long as they are interoperable. And what is the solution for this? I mean, we can create new standards, of course, but there are already a lot of good standards existing. So what should be done is to foster the use of the existing standards instead of, recreating all the time. And then let me give some advertising to a topic which is going to be funded by Horizon next year, precisely on interoperability. It's public procurement of innovative solutions, aiming at supporting procurers, public procurers, implementing e-health or m-health interoperability. So I can give you more details afterward if you want. This call deadline is 2017. So if you know organizations ready to buy innovative solutions using e-health standards, maybe it is worth investigating about this. And there is still time, because we have still 5 months ahead. Because I know, Horizon is not that easy to create consortia, especially with pre-commercial procurement and public procurement for innovative solutions. It requires a lot of time. And then let me add 2 other critical factors for the uptake, which are the digital health literacy. We are living in a time in which the main source of information is Dr. Google. So you can imagine how much it's important to ensure that people can make the difference between trustworthy sources and information that can be harmful. Recently, there was a study run by a Dutch university, and only 1 out of 8 member states could prove that half of the population, only half, had sufficient level of digital health literacy. So it is key to keep on investing on this thing. And then user-driven innovation. I'm sure you have heard about co-creation of health. It's a kind of fancy term, but it's true that the more systematic involvement of the users is key for the uptake. We are in a digital DG, and a lot of our colleagues are very fan of technology, but unless we are answering to current or future needs, there will not be uptake. This is very important. And I will not take more time. I think I have already covered the 10 minutes and more, but I just want to stress the very important aspect to tackle. Eva has already mentioned a lot, and this is the data. So data is key to the reform of the healthcare. Even if it is an increasingly data-intensive domain, there are still many restrictions for the access and for the sharing of the data. Sometimes these are explained because there is fragmentation or because there is insufficient interoperability, but also by conscious decision to limit the circulation on grounds of privacy or other. And it's true that we are talking about sensitive data, so anonymization, consent, and safety are essential. But we have to be conscious that restrictions have a very huge cost in terms of research on rare diseases, neurodegenerative diseases, cancer, and even also by denying effective treatment to a patient abroad. So I think in this debate that is going to start on the free flow of data, it is important to ensure a right balance between protecting data and between ensuring data protection rights and the need to support public health objectives.